So let's talk specifically about gastrinomas. By the way, I'm going to refer to it as gastrinoma from here on out, not Renee Zellweger syndrome or whatever it's called. I hate eponyms. So to understand the syndrome caused by gastrinomas, you have to understand what gastrin does. It's a GI hormone that's primarily responsible for increasing the synthesis of stomach acid, and I'm sure you can see why too much of this stuff definitely is not a good thing. Can you think of certain symptoms? Ulcers is definitely a good answer. In fact, this syndrome causes some of the most heinous ulcers you've ever seen in your life, all the way down to the jejunum. If you see the word jejunal ulcer on the test, that's actually incredibly uncommon in peptic ulcer disease, and finding an ulcer as far down as the jejunum is extremely suggestive of Zollinger-Ellison syndrome because pretty much nothing else causes that quantity of acid secretion. If you're scoping the patient, you might also notice hypertrophy of the stomach's rugae because gastrin causes proliferation of the cells in the stomach. Finally, the duodenum gets so acidic that it literally inactivates pancreatic enzymes, and this leads to severe diarrhea and malabsorption. Now, the test for gastrinomas is pretty weird. It's called the secretin simulation test. Now, those of you budding gastroenterologists may be thinking to yourself, but wait, Arjun, doesn't secretin inhibit gastrin? Well, that's usually correct. If gastrin is the acid hormone of the GI tract, then secretin is pretty much the antacid hormone. But for some reason that nobody can quite figure out, gastrinomas reliably increase their gastrin output when hit with a large bolus of secretin. Maybe figuring out why will be your famous discovery someday. You can treat the symptoms of acid hypersecretion with proton pump inhibitors and of course octreotide, but since gastrinomas do have malignant potential, you'll probably want to surgerize them eventually.